When a child presents with a persistent cough, wheeze, or breathing difficulties, many parents and even clinicians immediately think of chest infections or asthma. But there's a commonly overlooked contributor that can quietly drive these symptoms called allergic rhinitis. Often dismissed as just a bit of hay fever, allergic rhinitis can have a significant impact on a child's respiratory health and overall quality of life. So what is it? Well, allergic rhinitis is a condition caused by an allergic response to airborne particles, such as pollen, dust mites, mold spores, or pet dander. And this leads to inflammation of your nasal passages. Typical symptoms include things like a blocked or runny nose, sneezing, especially in the morning, itchy eyes, ears, nose and throat, and also a postnasal drip, which is mucus dripping down the back of your throat, mouth breathing, and potentially snoring at night as well. And sometimes children report reduced sense of smell. It can be seasonal, such as with hay fever symptoms triggered by pollen in spring or summer, or it can be all year round, often due to dust mites or pets. So how is this linked to coughing and wheeze? So whilst allergic rhinitis itself affects the nose, it can also cause coughing and make wheezing and chest tightness worse in children who also have asthma. Excessive mucus produced as part of the inflammation in the nose can drip down into your main airways, causing irritation and more inflammation lower down. This can then present as a chronic cough, which is often described as wet and worst first thing in the morning. And the blocked nasal passages themselves can also make it harder to breathe, worsening any pre-existing respiratory symptoms further. So what are some of the clues that might point towards allergic rhinitis? Well, in some children, allergic rhinitis is obvious, presenting seasonally as hay fever, itchy eyes, lots of sneezing. But in others, the signs can be more subtle and include things like a constant nasal congestion or mouth breathing, frequent clearing of the throat, a persistent wet or sometimes even dry cough without any infection, or simply as poor sleep, snoring, or daytime tiredness. These symptoms are often attributed to colds or viral infections, particularly in younger children, but if they persist, then allergic rhinitis should be considered. So why is it important to treat children with rhinitis? In children with moderate or severe symptoms, untreated allergic rhinitis can have a significant impact on their sleep quality, on their school performance, on their concentration and mood, and in children with asthma also impact on their symptom control and increase their risk of having attacks. How is it diagnosed and treated? So diagnosis is often clinical. It's based on the history and symptoms. In some cases, allergy testing, like skin prick or blood tests, can help identify specific triggers. And first-line treatment, if it's diagnosed, includes things like non-sedating antihistamines, which are helpful for sneezing and itchy eyes, daily intranasal steroids to reduce inflammation in your nasal passages, and of course avoiding allergies such as hypoallergenic bedding, avoiding animal triggers including your own pets, and keeping windows closed during high pollen counts. For more severe or persistent cases, a referral to an allergy specialist may be appropriate. Consider things like immunotherapy to desensitize against certain allergens, or even injections of biologics. When should a referral be considered? So a referral should be considered if your child's symptoms are not controlled despite first-line treatments, if a child has poorly controlled asthma or frequent respiratory symptoms despite asthma treatments, if there's any uncertainty about the diagnosis, then a referral to a specialist respiratory or allergy consultant may be worthwhile. So in summary, don't forget the nose. Allergic rhinitis can be more than a nuisance. It's a key driver of respiratory symptoms. It's often under-recognised in children, and identifying and managing it effectively can improve chronic respiratory symptoms such as cough, improve your asthma control, and improve sleep and quality of life. If your child has a persistent blocked nose, cough, or struggles to wheeze despite asthma treatment, then it may be time to consider whether allergic rhinitis is part of the picture.